Becoming a new parent can be amongst one of the most exciting and challenging times of our lives. And while it's critical that the newborns get the best possible start in life, it's vital that parents get the support they need too. That's why Karitane was set up. The New South Wales-based organisation is a leader in the delivery of accessible and innovative programmes that build parenting capacity in the community. Louise Donnelly has been seeing how they blend the latest thinking with cutting-edge technology.
They say there's no greater love than the love of a parent for their child. However, as many mums and dads know, parenting can be one of the hardest jobs you will ever do. But there is support, and Karitane want you to know you are not alone.
Karitane has been a leading provider of parenting support services since 1923 in New South Wales. And so we provide a range of parenting support services for families with children from the ages of 0 to 5 years of age.
Sam Paparitis is a mother of 3 children under 4 and sought help for her son Dion's behavioural issues. She and her husband began taking Dion to Karitane's specialised toddler clinic for parent-child interaction therapy, an evidence-based program providing live coaching to parents during parent-child play sessions.
My husband and I just found that we weren't able to parent him as well as we wanted to. We just didn't know how to handle him, all the ways that we were brought up with and just weren't working. And we just wanted our house to be more happy and settled, and we just found that it was very intense with him at home. Once he was okay up until he turned about 2, and then that's when his tantrum started.
Nice imitating. Wow, he's really letting you join in the game. That's great. He loves playing with you.
Sue Morgan from Karitane's toddler clinic is the only PCIT Level 2 trainer in Australia and says the results are transformational.
I remember one family that came in, and she was a young mum with a 2-year-old and a little baby she was carrying in her arms. And she said she just couldn't go on anymore. She was at the end of her tether. And we started doing some treatment just on the spot with her, doing some coaching and helping her to contain her little boy's tantrums, to be present with him and to help him calm down and to keep her calm as well. And in that time, she noticed some little glimpses of what things could be like for him. And it was just such a privilege to be able to work with her and help her to see her little boy in a different light.
Dr. Jane Kohlhoff is a research expert in the field.
Parent-child interaction therapy, or PCIT, it's a parent training program, but it's really unique and powerful in that parents receive live coaching in the moment while they're interacting with their child from an experienced therapist.
Karitane is now pioneering this therapy, replacing the one-way mirror with a computer screen, providing this therapy to families in their own home.
In recent years, there's been some research looking at how the same program adapted through and delivered via the internet is also really effective. They randomly allocated families to receive in-clinic parent-child interaction therapy or via the internet, and they found that the results were really very comparable. And in some domains, the internet-delivered program was actually more effective.
In addition to PCIT being offered remotely with teleconference technology, Karitane is also using this digital platform to bring the expertise of a child and family health nurse into family homes with virtual home visits. First-time mum Belinda Kiriakou is an advocate for virtual home visits after receiving the support she needed with her daughter Marina within days of getting a referral from her GP.
I got to visibly see her and talk through things, and she was able to see how I would breastfeed and just engage a bit more, because it's different. You can talk to someone over the phone, but just to see that there was just I was talking to another human, and it was just really important for me because instead of just waiting for a call, she was so welcoming. You know, it was better to visually see someone, where the phone calls did help, but that really did help me.
And I grab the left-hand side and cover both arms, and then the other side across, and then I flip her up.
Rebecca Gallagher is Karitane's Digital and Telehealth Innovations Manager and says virtual home visits offer the same level of care as parenting centres, but support families in the comfort of their own home, not only benefiting parents in metropolitan areas, but also those living in rural or remote communities.
Families come to Karitane for help with feeding, settling, routines, what's normal kind of routines for their babies or their children, toddler tantrum issues, night waking issues, and adjustment to parenting for some parents in terms of having feelings of anxiety or depression as well.
With Karitane leading the way in the innovation of digital health services in child and family health in Australia, thousands more children and families are able to be supported.
The important thing also with digital health technology is that really it only knows the boundaries of the funder. So if there's a family in ACT or in Darwin or in Melbourne who want it to access or care, there's really no limitation other than who's funding us as to who can access that care. So if somebody wants the expertise of the toddler clinic and PCIT, they technically could access through that digital platform.
Karitane offers a range of services and they're free with a referral from a GP or healthcare professional, offering parenting support without any financial burden.
It was just the help that I really needed.
Like especially with my husband, it's also helped him tune into how Dion's feeling, rather than just focusing on the negative and things like that. We're able to, he's able to like know why he's upset. Definitely reach out to Karitane. It's such a wonderful service.